Hello friends, welcome to Healthwizac Medical Concepts Simplified. In this video, we will learn about organophosphate poisoning, which is a medical emergency demanding urgent critical care management. Organophosphate is an industrial chemical agent with varied use as an insecticide, pesticide, nerve agents, and chemical warfare, and are available as malathion, parathion, and chlorpyrifos. They are highly toxic to human, animals, and plants when exposed. Organophosphate compounds absorption in body can be through various routes including skin, inhalation, ingestion or injection due to various modes of exposure like occupational exposure through pesticides, insecticides and herbicides, environmental exposure through chemical warfare, accidental ingestion or attempt of suicide or deliberate self-harm. Organophosphate poison works by binding with acetylcholine esterase enzyme which helps in hydrolyzing acetylcholine, a neurotransmitter responsible for nerve impulse conduction and transmission from nerve fibers to cells. Due to inhibition of acetylcholine esterase enzyme, acetylcholine starts accumulating at the synapse and causing cholinergic toxidrome. This causes overstimulation of both muscarinic and nicotinic receptors of parasympathetic and sympathetic nervous system distributed over varied organs and thus giving rise to symptoms of CNS, CVS, RS, etc. Muscarinic receptors overstimulation is manifested through symptoms which goes by mnemonic called dumbbells, where D stands for diarrhea and diaphoresis, that is excess sweating, U stands for urination, M stands for meiosis, that is pinpoint pupils. B stands for bronchospasm, bronchoria, and bradycardia. E stands for emesis or vomiting, along with gastric cramps. L stands for lacrimation, and S stands for salivation. Nicotinic receptors overstimulation is manifested through symptoms which goes by mnemonic called rhythms, where R stands for respiratory failure, HY stands for hypertension, T stands for tachycardia, M stands for mydriasis, and S stands for sweating. CNS symptoms are manifested through coma, agitation, confusion, psychosis, seizures, muscular weakness, paralysis, and fasciculation. Diagnosis of organophosphate poisoning is done by checking serum cholinesterase level or pseudocholinesterase level in blood, whose values helps in diagnosing the severity of poisoning and can be labeled as mild poisoning, in which the enzyme levels are 20 to 50% of normal value, moderate poisoning, in which the enzyme levels are 10 to 20% of normal value, and severe poisoning, in which the enzyme levels are less than 10% of normal value. Other investigations that helps us to find out the systemic impact of poisoning includes CBC, LFT, RFT, ABG, ECG, chest X-ray, brain imaging, nerve conduction test, EEG, and urine toxicology profile. Now, let's have a look at the treatment part of organophosphate poisoning. Treatment of any poisoning, including organophosphate poisoning, can be summarized by the mnemonic called CARE, where C stands for supportive care, A stands for antidote and prevention of further absorption of poison, R stands for prevention of re-exposure, and E stands for elimination of poison from body. In case of suspected organophosphate poisoning, as soon as the patient arrives in ER, a quick systemic evaluation and vitals should be checked, followed by early IV access along with collection of blood samples for evaluation, and cardiac monitor should be attached. Local government authorities should be informed immediately. If the patient is hemodynamically stable, Ryle's tube should be inserted and gastric lavage should be started, preferably with normal saline, to eliminate the residual consumed poison from the stomach. External decontamination by cleaning body surface with water should be done immediately, along with eye irrigation with normal saline, and patient's clothes should be removed to avoid further skin contact or exposure. IV fluids, preferably 0.9% normal saline, should be started to maintain systolic BP to at least more than 80 mm of mercury. If the patient is hemodynamically unstable with poor GCS, urgent intubation should be done, followed by mechanical ventilation. In case the signs and symptoms are confirmative of organophosphate poisoning, or relatives or friends are carrying the consumed or exposed poison sample or container which is confirmative of organophosphate poisoning, Injection atropine should be given immediately, which is the antidote of organophosphate poisoning and acts as an antimuscarinic agent by antagonizing the effect of acetylcholine. Atropine is given in a dose of 1 mg IV stat and signs of atropinisation should be checked, which includes clear chest, heart rate of more than 80 per minute, systolic BP of more than 80 mm of mercury, dry axilla, and no pinpoint pupils. If above signs are achieved, then depending upon the signs and symptoms, atropine bolus of 2 to 5 mg every 10 to 15 minutes should be given to maintain the above parameters. On the other hand, if the patient is not responding to above management or no signs of atropinisation is seen, then dose of 1.8 to 3 mg IV atropine should be repeated every 5 minutes with doubling of every next dose till atropinisation is achieved. Then the required dose of atropine should be calculated and 10 to 20% of required atropine dose should be started as hourly infusion. Along with atropine, injection pralidoxim, which is an oxime and acts by reactivating inhibited acetylcholine esterase enzyme, should be started in a dose of 30 mg per kg or 1 to 2 gram twice or thrice depending upon the severity of symptoms. The above treatment should be continued until the serum choline esterase level is satisfactory to label patient out of organophosphate poisoning. While treating patient with atropine, a close observation should be kept on patient to check signs and symptoms for atropine toxicity, which includes confusion, restlessness, delirium, agitation, hallucination, extreme tachycardia, dilated pupils, dry mucous membrane, and hypoactive bowel sounds. If the above symptoms starts appearing, then atropine doses should be tapered to reach minimum effective dose with no signs of toxicity. Apart from above definitive treatment, other supportive treatment should go hand by hand, which includes the following. In case of convulsions, patients should be started with benzodiazepine along with anti-epileptic drugs and regular EEG monitoring should be done. Arrhythmias should be managed with antiarrhythmic agents followed by close ECG monitoring. Friends, if you want to know more about ECG basics and interpretation, then please click on the I button on the right top corner of the screen or click the link given in the description box below. Patients should be given adequate hydration through normal saline or dextrose containing fluids in case of hypoglycemia throughout the treatment of organophosphate poisoning. Secondary infection should be managed with broad spectrum antibiotics. Fever should be managed with cold sponging, active fan cooling, and paracetamol in a dose of 10 to 15 mg per kg. It's better to insert central venous line for above management, and in case of hypotension, inotrope should be started followed by close monitoring of hourly urine output to avoid renal shutdown. Metabolic acidosis should be managed with IV sodium bicarbonate. Frequent sugar monitoring should be done and IV dextrose should be given in case of hypoglycemia. Once the patient seems hemodynamically fit with reversal of atropine toxicity and is intubated, weaning should be attempted followed by extubation as per the protocols. If the treatment is taking a longer duration and the bowel sounds are active, then RT feed should be started as per the nutritionist or dietitian opinion to avoid stress ulcers. Finally, neuropsychiatric evaluation should be done in case of deliberate self-harm to avoid such future events. So friends, this brings us to the end of this topic. Hope you find this information valuable and applicable in your clinical practice. Please do like and share this video and hit the bell icon for latest videos. And for more such informational videos on medical topics, please subscribe to YouTube channel Healthwizac Medical Concepts Simplified. Thank you.